Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today let's discuss few CPC practice questions from previous year's examination from the topic digestive system. So first question, Mildred was seen by the surgeon for a right parotid mass measuring 1.7 into 1.1 centimeter. She complained of pain and did not get relief from antibiotics. A rigid lateral lobe parotidectomy with dissection and preservation of the facial nerve was completed. What procedure code should be reported? Option A 42410 with RT modifier. Option B 42415 with RT modifier. Option C 42420 and option D 42330. So here what procedure is being done? Initially some treatment has been given with medications, but she has no relief from the antibiotics. So, doctor has undergone parotidectomy with dissection and preservation of facial nerve. That is a procedure. So, let's look onto each CPT codes. So, let's move on to the first option 42410. So, please take 42410 in the CPT code book. Here it is. Excision of parotid tumor or parotid gland, lateral lobe without nerve dissection. In our question, it is a rigid lateral lobe parotidectomy with the dissection. So that will not be the answer. Option B, 42415. What is 415? Lateral lobe with dissection and preservation of facial nerve. Yes. This is what is our question, with the dissection and preservation of facial nerve. Still, let's look on to the other two options. 42420. Here, total with the dissection and preservation of facial nerve. Total. No, for us it is lateral lobe. Only right parotid mass it is mentioned here, right? A rigid lateral lobe parotidectomy. It's mentioned there, lateral lobe. So, 42420 is total, whereas 42415 is lateral lobe. That is our question. Last option 42330. 42330 is here. Cyalolithotomy. No, that is some other option. So, our answer will be 42415. And in the question it's mentioned right parotid mass. So, we will append it with the modifier RT. So, the answer is option B 42415 with modifier RT. Next question. An 82-year-old female had a CAT scan which revealed evidence of a proximal small bowel destruction. She was taken to the operating room where an elliptical abdominal incision was made, excising the skin and subcutaneous tissue. There were extensive adhesions along the entire length of the small bowel. The omentum and bowel were stuck up to the anterior abdominal wall. Time-consuming, tedious lysis of adhesions was performed to free up the entire length of the gastrointestinal tract from the ligament to trace to the ileocolic anastomosis. The correct CPT code is option A 44005, option B 44180 with modifier 22, option C 44005 with modifier 22, and option D 44180 with modifier 59. Here, what is CAT scan? Computer aided tomography. Okay. So, this female has undergone a CAT scan which shows proximal small bowel destruction. So, she was taken to the operating room, and what procedure was done? Elliptical abdominal incision was done. Then excising the skin, excision was done, and subcutaneous tissue. This omentum means omentum is also a tissue, a type of tissue. Then what did the physician do? There were extensive adhesions along the entire length of the small bowel. Time-consuming tedious lysis. All these are just stories. Okay. So let's move on to the CPT codes. So what procedure is being done here? Incision, excision of the skin and subcutaneous tissue. So let's check each options one by one in the CPT code. So here the first option 44005. Let's look into 44005. This means enterolysis, freeing of intestinal adhesion, separate procedure. So in our question it's mentioned there were extensive adhesions along the entire length of the small bowel, and then time consuming adhesions was performed to free up the entire length. So it can be this one. Anyway, let's move on to other options. C is also same 44005 with modifier 22. What is modifier 22? Modifier 22 is increased procedural service. So let's move on to B. Option B 44180. 44180. Here it is. Laparoscopy. This represents laparoscopy code. Laparoscopy surgical enterolysis, freeing of intestinal adhesion, separate procedure. So this is also freeing of intestinal adhesion, but there is no laparoscopy performed here. Nothing mentioned about laparoscopy. So the answer will be either option A or option C, 44005. Because the other two codes are same, 44180. Only the modifier is different, 22 and 59. So 44004. So the answer will be either option A or option C. Here, what did the physician did? Patient was taken to operating room when an elliptical abdominal incision was made, excising the skin and subcutaneous tissue. There were extensive adhesions along the entire length of small bowel. Omentum and bowel were stuck up to the anterior abdominal wall. Time-consuming tedious lysis of adhesions was performed to free up the entire length of the gastrointestinal tract from the ligament to treat to the ileocolic anastomosis. So here the physician has done more procedure, like initially an incision was made, then excision of the skin, excision of subcutaneous tissue, then extensive adhesions were made. All these multiple procedures were there. So the answer will be option C with modifier 22, 44005 with modifier 22 as an increased procedural service. Third question, 15-year-old female is to have a tonsillectomy performed for chronic tonsillitis and hypertrophied tonsils. A McLever mouth gag was put in place and the tongue was depressed. The nasopharynx was digitalized. No significant adenoid tissue was left. The tonsils were then removed bilaterally by dissection. The uvula was a huge size because of edema. A part of this was removed and the raw surface overseen with 30-chromic catgut. Which CPT codes should be used? 42826, 42107 with modifier 51, 42825, 42104 with modifier 51, 42826, 42106 with modifier 51, 42842, 42140. So what procedure is being done here? Tonsillectomy, removal of tonsils, because the patient was having chronic tonsillitis. Okay. Then nasopharynx was digitalized. No significant adenoid tonsils were then removed bilaterally by dissection. Tonsils were then removed by dissection. Uvula means the inside the mouth, organ inside the mouth. Uvula was a huge size because of the edema. Part of this was also removed. So let's look into the each and every CPT code. Let's move on to the first option, 42826. First CPT code, 42826. Here, tonsillectomy, primary or secondary, age 12 or over. Yes, this is age 15. So it will be 42826. 42825 is primary or secondary, younger than age 12. So 42825 will not be the answer. Option B will not be the answer. Okay. So 42826 and then 42107. What is 42107? So what is 42107? It's here with local flap closure. 42107. And in option C, what is 42106? 42106 here with a simple primary closure. So if you consider option A and C, only one code is different, 42106 and 42107. So is it local flap closure or simple primary closure? That you need to identify it from the question. Then one more option is there, 42842 and 42140. 42140 is here. Uvulectomy, excision of uvula. I am talking about option D. Okay, 42140 is uvulectomy. But yeah, uvulectomy is mentioned there in the question. Uvula was a huge size and a part of it was removed. So it means uvulectomy, excision of uvula. It can be there. But what about the initial code 42842? Let's move on to 42842. So 42842 is here, radical resection of tonsil, tonsillar pillars, and or retromolar trigone without closure. No, this is not a radical resection of tonsil. So let's look into the other options only. It can be 42106 or 42107. So here 42106 is simple primary closure, 42107 local flap closure. There is nothing mentioned about flap closure, right? Nothing is mentioned about flap closure. So it will be 42106. Yes, that comes in option C, 42826, 42106 with modifier 51. What is modifier 51? Multiple procedure. So anyway, this will be the answer because 4210, 42826 and 42106 is there in the option C. So the answer is option C. Fourth question. A 35-year-old male has internal hemorrhoids and has elected to have them removed. The ligator and alligator forceps have been inserted through an anoscope. The physician identifies the most prominent hemorrhoid and ligates it at the base with a rubber band. What CPT code should be reported? 46250, 46948, 46255, 46221. This is a simple question. This is just removal of internal hemorrhoids. So let's directly move to the codes. So here the first option 46250. We have four options, 46250, 255, 221 and 948. So let's look into all those codes. 46250. It's here. 46250. Hemorrhoidectomy external, 2 or more columns or groups. 46255. Please look into option C. 46255. Hemorrhoidectomy internal and external, single column or group. 250 is external, 2 or more columns. 255 is internal and external, single column. Here in the question, it's mentioned it's nothing mentioned about the internal or external column, right? So check for option D. Check for option D, 46221. It's here, hemorrhoidectomy internal by rubber band ligation. So here it's mentioned in the question, the ligator, about ligation is mentioned. The ligator and alligator forceps have been inserted. So rubber band ligation is there. Okay. And the physician identifies the most prominent hemorrhoid and ligates it at the base with a rubber band. So it means it's a rubber band ligation. So the answer will be option D, 46221. Option B, 46948 is just excision procedure on the anus. So anyway, the option answer will be option D, 46221, because it's clearly mentioned in our question. Internal ligation, internal by rubber band ligation. So the answer is option D. Let's look into one more question. An 81-year-old woman underwent a radical right hemicolectomy for carcinoma of the ascending colon. She returns at this time as advised for a follow-up colonoscopy. The physician inserts the video colonoscope into the anus and starts to advance the scope through the colon past the splenic flexure when patient's blood pressure drops. The physician elects to terminate the procedure and the scope is withdrawn. What are the correct CPT codes? So here, the patient is undergoing follow-up colonoscopy. But when the physician inserts the video colonoscope into the anus, he has reached till the splenic flexure by the time patient's blood pressure drops. So the physician couldn't continue the procedure. So he has terminated the procedure. What will be the correct CPT codes? 45378 with modifier 53, 45391 with modifier 22, 44360 with modifier 52, 45399 with modifier 59. Let's look into each and every codes. So here first option 45378. What is 45378? Colonoscopy, flexible diagnostic including collection of specimen by brushing or washing when performed. So here flexible colonoscopy, diagnostic including collection of the specimen when performed. Let's look into the other options. What is 45391? 45391. So option 45391 is here. Colonoscopy with endoscopic ultrasound examination limited to rectum, sigmoid, descending transverse or ascending colon. No, the doctor has discontinued the procedure. Doctor didn't reach till the cecum, colon and cecum. So this will not be the answer. What is 44360? See, 44360 is here. It's small intestinal endoscopy, heteroscopy beyond second portion of duodenum, all these things. No, this is not a small intestine endoscopy. Okay, this is colonoscopy. So that will not be the answer. 45399 will be unlisted procedure, like other procedures on colon. So just remove that also. So the answer will be either option A or option B. 45378 or 45391, which is colonoscopy flexible diagnostic including brushing or washing. And this has been appended with modifier 53. So what is modifier 53? 53 means discontinued service. A surgical procedure was started but it's discontinued. So this is a discontinued procedure. So it will be option A. The answer will be option A, 45378. Otherwise, there is one simple method to find the answer. Here all the modifiers are different in this question. So it's clear from the question that the physician has discontinued the procedure. So which modifier represents a discontinued procedure? It's 53. So the answer will be option A only. Okay, that's how also you can quote. So the answer is option A, 45378 with modifier 53. So friends, these are few important questions from 40,000 series. Let's move on to more topics in the upcoming sessions. So stay tuned for more videos. If you like the video, please like and share. Please subscribe to my channel. If there is any comments or queries, you can always mark it in the comments. Thank you so much for your support and stay tuned. Bye.